how these things work. And her main concerns, which is what we're targeting, were the area around her eye, the sort of tear trough depression. And if you look, this goes beyond tear troughs. You know, that's usually from here to here by definition. But if you really look, her rim, her orbital rim is up here by my finger, and there's a relative tissue deficiency that really just outlines her lower eye, and so, or her lower eyelid, if you will. And so really the best treatment for that is to continue the tear trough treatment to just soften that transition between the lid skin and the cheek pad here, which is descending with age, and that's why that line is developed. And it really is not so much an age thing, it makes you look tired, is probably the best description of it. She also was concerned about marionette lines or labiomandibular grooves here. And some good strategies have been discussed already about fixing that. She's got a little kind of jowl effect here. We can see the pump. I'm going to turn your head just a little bit to the side. If you fill this relative depression here between the mentum and the jowl itself and sort of bring this out, you can actually kind of trick the eye into making it look like a straight jawline. And that actually, all by itself, makes the marionette line look better. But typically I'll use Juvederm in this area, and then for the fine line we'll use a little Belotero. And maybe can you guys bring me the Xeomin? One of you guys is. I just bring some syringes, and then she also asked about the lines, and she was open to this. The one, I don't know if it's going to show up on the picture. Give me a good hard frown here. There's a little line that happens right up here. You really can't see it that well, but it bothers her, and I think it's primarily muscular. It doesn't have deep furrows, but this is nice enough to soften these lines. Okay. Yeah, you're doing great. And I like to move it around a little bit, not near the periosteum. You doing all right? Mm-hmm. Good. And that's pretty much it. Now you have half of your forehead without lines. Is that pretty good? Mm-hmm. Want to leave it that way, or maybe do the other side?
Maybe do.
That's good. So I'm going to do the same thing on the other side here. Fine lines. She's got little fine lines on her lip. This one in particular. Show me that. Where's that smile again for me? It's that little line right there. I don't know if you guys can see that. She really didn't like that little fine line there. So we pulled a little Belotero. Now, fair warning, we have some. Do we have any ice available? Like the ice pack. That upper lip is a little sensitive. I'm going to do your other side a little quicker. I'm going to have you raise your chin because I don't have any room. Yeah, we'll just you set that down first.
Okay.
So I'm going to have the ice just a little bit on the lip. I think ice is a great tool for anesthesia.